One of the techniques that we use for patients who have had a total laryngectomy is called esophageal speech, and specifically the glossopharyngeal press. So an example of this technique is, esophageal speech is used for the patients with laryngectomy, but during this process it creates airflow that allows for the vibrations in the esophagus that are necessary for speech production. So in a therapy session, I would begin with having the client identify parts of the mouth that contribute to the proper production of speech. So these parts of the mouth would be, okay, first I'm going to have you identify your tongue. So hopefully they would show me their tongue, and then I would go on to say, okay, can you now show me the roof of your mouth? And I would also have pictures to show them if they were confused or needed a cue. So I would prompt them, and then I would also inform them that that's also called the alveolar ridge, but roof of the mouth is fine for technical terms. And then after this, I would obviously want them to be able to identify their mouth, but also the esophagus. We will just refer to this as pointing to our throat or showing this. So as I said, all of these structures come together to create speech. So first I would have the client take the tip of their tongue and press it to the tip of their mouth. And then I would say, okay, now I want you to push air down into your esophagus. And then this creates an expulsion of air that comes back out, which is also necessary when speaking. So once air goes down, it comes back out, and this is caused by the esophagus vibrating. So the goal of this technique is to have the client reliably phonate on demand. So the goal at first would just be to do simple expulsions and also to get them comfortable, and then eventually you would move on to longer expulsions.